Ever feel pain in the side of your neck that seems to travel into your shoulder, upper chest area, arm, forearm, even down into your thumb or fingers? It can be confusing. A lot of people immediately wonder, is it a pinched nerve? Sometimes it can be nerve related, but there are also small muscles in the front of the side of the neck that can create a surprisingly similar pattern. Today we're talking about the scalene muscles. Scalenes are small muscles located along the front and side of the neck. They attach from the bones in your neck down to the first and second ribs. Their job is not just to move the neck. They also help stabilize the neck and upper ribs, assist with neck control, help with side bending the neck, and they can even help lift the upper ribs when you breathe. So even though they are small, they can end up working a lot throughout the day. When these muscles become irritated or overloaded, symptoms may not stay only in the neck. Some people feel aching or tightness along the side of the neck. Others may feel discomfort near the top of the shoulders, around the shoulder blade, into the upper chest, and even down the arm into the forearm, thumb, index, finger, or hand. If may feel like aching, tightness, deep pressure, a grabbing sensation, or sometimes even numbness and tingling. This is one reason this can be tricky. A muscle problem in the neck can sometimes feel like it's coming from the shoulder, arm, or hand. So why does this happen? The scalenes can become overworked when they are asked to do too much for too long. This can happen with forward head posture, long periods of sitting, desk work, driving, heavy carryings, repeated pushing or pulling, sports activity, stress, or even certain breathing patterns. For example, when someone breathes mostly into the upper chest and shoulders, instead of using a more relaxed lower rib or abdominal breathing pattern, the neck muscles may start helping with every breath. Over time, that can be like asking a small muscle to do work all day. Another important part is that major nerves and blood vessels traveling into the arm pass near the area, so when the scalene upper rib area become tense or irritated, symptoms may sometimes be felt further away into the shoulder, arm, or hand. A simple way to picture is this: the nerves going into the arm pass through a crowded neighborhood near these muscles. If that area gets tight or irritated, the arm may feel symptoms, even though the arm itself may not be the original problem. Some triggers can include sitting at a desk with the head drifting forward, driving for long periods with the shoulders tense, sleeping with the neck bent or compressed, carrying a heavy bag on one shoulder, heavy lifting, upper body sports, persistent coughing, or breathing patterns where the chest, shoulders rise a lot. Now here's a simple awareness check. Place a hand gently on the side front of your neck. Do not press hard. This is a sensitive area. Now take a breath by lifting your upper chest and shoulders. You may feel those neck muscles turn on, especially with a deeper breath. Now try slowing the breath down. Relax your shoulders and let the breath expand lower into the ribs and abdomen. The goal is not to force your belly out. The goal is simply to keep the neck and shoulders from doing all the work. When the shoulders rise with every breath, the scalenes may be helping more than they need to. Now let's add a simple posture reset. Gently let your shoulders relax down. Bring your chin slightly back, not down and not forced, almost like you are making the back of your neck a little longer or taller. Then take a slow breath in through the nose, keeping the shoulders relaxed, and slowly exhale. Repeat that for a few breaths. The purpose is to reduce unnecessary tension to the neck and the upper shoulder area. A few times during the day, check in with yourself. Ask, are my shoulders creeping up? Is my head drifting forward? Am I breathing mostly into my upper chest and back? Also be careful with aggressive massage on the front side of the neck. This is a sensitive area, and with too much aggression, it can become irritated rather quickly. Gentle movement and relaxed breathing are usually safe for starting position unless you're being guided by a trained professional. Now, this part is important. If symptoms are persistent, worsening, or spreading into the arm or hand, it is worth getting evaluated. If you have numbness, tingling, weakness, loss of grip strength, swelling, color changes in the hand, symptoms are often come after trauma or car accident or chest pain. Do not assume it's just a tight muscle. Those symptoms deserve a professional evaluation to rule out more serious causes. At Integrated Health Solutions, we help evaluate where these symptoms may be coming from, and what tissues may be involved, and what movement, postures, or habits may contribute to the problem. Then we work with patients through coaching, exercises, ergonomic changes to help reduce unnecessary tension and improve how the neck and shoulders function. So the big takeaway at this: small muscles in the neck can sometimes create symptoms that feel larger than the muscles themselves. The scalenes can contribute to symptoms in the neck, shoulder, chest, arm, forearm, and hand. And because they also help with breathing and upper rib movement, posture and breathing habits can play a big role. Start simple. Relax the shoulders. Bring the head gently back toward neutral. Practice slower breathing that does not rely so much on the neck. Pay attention to the patterns your body gives you, and when symptoms are persistent or concerning, get them checked out. To schedule an appointment with Integrated Health Solutions, visit www.ihsna.com. Thanks again.